Can you carry this, babe?
The oxygen machine, a constant companion for Christina Derksen-Unrau. Her lung capacity has shrunk to 30%.
This is my normal walk.
And doctors have told her the only option is a transplant. But despite the obvious urgency, she isn't active on the transplant list.
I don't have enough money to save my life.
Chris was given the okay that she was a candidate for transplant in December 2022. But the transplant team hit her with a cold dose of reality. The post-operative care is expensive. She would need to move from Princeton to live in Metro Vancouver, close to VGH, for months. She turned to crowdfunding, raising $20,000. But having the money wasn't enough.
Physically, you had to prove to our healthcare system that you had enough money to deal with the post-op care that was coming.
I had to open the app on my phone and show the doctor that we met with.
Ultimately, it's Adrian Dix who is responsible for BC Transplant and Vancouver Coastal Health, where this surgery would be done. We informed the Health Minister's office of this issue on Friday, and despite 2 full business days, no one was made available for comment.
Mr. Dix, if it was your wife and you didn't have access to money, but it was the only way you could save her life, what would you do?
When Chris asked the transplant team if she would be listed if she didn't have the money, the social worker responded via email. You need to let us know that you will be able to cover the costs of your housing arrangements and other living expenses for 3 to 6 months in Vancouver. This commitment is required for all lung transplant patients. The Rural Healthcare Network says this type of situation happens all over BC and is patently unfair.
Seems to be the most egregious inequity that somebody can possibly face. You know, you have been just told that your life is going to end unless you have this amount of money.
In the year since that first encounter, the costs have only gone up.
Okay, that's enough.
By the time Chris was actually able to be listed this year, the estimate is more like $40,000. And she couldn't face going back to her friends and community again.
It's soul-crushing, because I just want to live my life with my husband, my kids, my grandkids.
She is running out of time. Aaron McArthur, Global News.